All right, so the next organ next to the the common bile duct and the liver is our friend pancreas. And
Yes.
you normally don't hear about it till it's get angry. The
Right, right.
minute it get angry, it will let you know. It's one of the worst pain you can have. Some people say it's worse than childbirth or kidney stones.
Pancreas is to be dealt and handled with a great deal of caution. Unlike the liver, like I told you that, or I told the audience that liver is very forgiving. It'll come back. It'll repair itself and do. Pancreas, when it gets angry or when it gets, say, inflamed, it sometimes may have lifetime's consequences on it. So so the most common cause of pancreas getting angry, so to say, or getting pancreatitis is gallstone disease. That often is an acute pancreatitis that then gets better without consequences, as long as we know that we've taken care of the problem, which is we've handled the gallstones by removing the gallbladder and improving our diet and improving our activity and avoiding alcohol. The problem comes with recurrent attacks of pancreatitis, and some people have their immune system is such high functioning that they actually get a very severe pancreatitis right up front. So once you've had a pancreatitis, you really need to have a lot of attention paid to your lifestyle. If I tell you that, okay, you've had a pancreatitis that was from alcohol intake, I would tell you alcohol is bye-bye for you. You may take a sip here and there because it's not good to tell people that you're being deprived of something. But substantial alcohol intake, you're going to cause yourself life-changing problems. So that's number one. Then, of course, we need to be paying attention to what, anytime your medications are written, and if you've been on pancreatitis, you want to make sure you check with your primary care physician, your pharmacist, that, okay, are there any medications that could hurt my pancreas here? But blood pressure medications and diuretics, thiazide diuretics, and even something like acid suppression medications. So there are lots of these common medicines that can cause pancreatitis, and you have to be careful.
The thing people worry about the most is pancreatic cancer. The reason for that is by the time you diagnose, it's already metastatic. And one of the figure you showed up there is very scary. 60,000 cases and 40,000 deaths. So hardly anyone survive the pancreatic cancer, Ramesh. So that's a
So
serious
here,
cancer like ovarian cancer, which is hard to diagnose, not symptomatic till it's too late. So, uh, any advancements on tumor markers or any other techniques that we have in coming in future to pick it up early?
right. So the issue really is that it's certainly not, it's about seventh or eighth in the hierarchy of common cancers. So it's way, way down there as far as number of cases occurring every year. So, lung, breast, and colon, take, and of course prostate. Those are the most common cancers, but they don't kill as much as high of a percentage as you'll hear about. A lot of people having other cancers and then making it 5 years. The 5 year survival rate a couple of years ago till was about 7 or 10%. So the idea lies. So here's a cancer that you see in this picture. It's already growth in the head of the pancreas, and it's already involving the duodenum. It's projecting into the intestine. And if you see the next picture, where here is what we would like to catch all pancreatic cancers, where it is limited to within the pancreas and is less than 2 centimeters or less than an inch in size, where we can actually completely remove that part of the pancreas and give a sort of curative response. The key in these is that we, at least in the United States, have not, none of our societies, including American Cancer Society, has yet taken this approach of taking tumor markers like CA19 or CEA, the carcinoembryonic antigens, as screening tests. Some of the European countries are testing these out as screening. And we believe here, at least in the United States, that approach leads to many more unnecessary scans. Endoscopic ultrasound in the last 15 years, and that's how my interest grew in endoscopic ultrasound. Endoscopic ultrasound has had a substantial early diagnosis and staging of the pancreatic cancer, and our ability to do a fine needle aspiration. And so we can put an endoscopic ultrasound scope and get to that area where the cancer or the growth may be, and put a needle in there and get a biopsy rather than going from the skin, because then the biopsy is coming from that area where if we find cancer, it will get removed. And so there's no chance of needle spreading anything else. So this is an evolving field. Endoscopic ultrasound is definitely added to our ability to identify resectable from completely resectable to non-resectable patients, so you don't take people to unnecessary surgeries, and so on and so forth.
Is there a role for lifestyle changes like quitting smoking, losing weight, alcohol reduction in pancreatic cancer being less?
Right. So there are about 9 or 10 different interventions, and smoking gets like first 4 or 5 of those. So yes, there's no doubt tobacco has a clear-cut role even in pancreatic cancer. BMI over 29 and 30 itself, again, is a higher risk for pancreatic cancer, colon cancer. So GI cancers and obesity have a higher role. Patients with diabetes have a slight preponderance of pancreatic cancer.
So, coming back to our motto of prevention,
Right.
in terms of liver cancer, in terms of pancreatic cancer, gallbladder cancer, not that common either.
Right.
What common theme coming through again? Is it not smoking? Is it getting you screened for Hep B, Hep C, and getting it treated if you find it? Is it lifestyle changes, making sure your sugars are under control? If you have cirrhosis, you increase hepatocellular cancers too. So if you cut back on the alcohol, or autoimmune disorders, then you get it treated earlier. And then we talked about role of the medications. So less is good with medications and exercise. Anything else which will prevent cancers?
If you really want to take care of yourself, then health as a part of lifestyles be intertwined. You have a healthy concept that you really need to take care of this body, and you can't just pop pills and make yourself better. Your body needs to be in harmony with what you are able to achieve. So what you put in your body, what you eat, how much you exercise, how much you give stress has an immune response that we know that all of these conditions that we did not highlight this, we know now stress can have an exaggerated response of how the body reacts, and stress can reduce the speed at which your body can heal itself. We also know lack of sleep as a carcinogen being identified. So those are the things that we really need to pay attention to, that things like tumor necrosis factor in our body. Tumor necrosis factor is a very interesting concept. These are factors that keep the tumors from growing, they keep them down. So when you have a stress level go up, the production of tumor necrosis factor goes down, so tumors can grow more. So when people realize that, oh my God, he was okay, but then, stressful lifestyle, and then suddenly something happened. So your body tries to deal with things as long as it can, until you try to make it do more than what it should. So eat healthier, exercise, pay attention to obesity, make sure, for men especially, visit to the doctors need to become a lifestyle. And I'm telling this to myself also.
Let's just recap on some of the great points you brought today to our audience for the health of the liver, gallbladder, and pancreas. The first thing is moderation on alcohol. I think that's very important. And all these organs sit next to each other and they talk to each other. So if you cut down alcohol, they all three will be happy. Number one. Doesn't mean you don't have fun. You can have fun, but have fun with less alcohol. Number two, no smoking. So, that impacts your higher risk of pancreatitis, higher risk of pancreatic cancer, or a host of other cancers. So, for if you don't want to, liver too, yes. Number three, if you have done some, parties and things in your 20s, which all of us, were young and strong at the time, but if if there is a concern, get your Hep B, Hep C testing done. And the good news is the Hep B is totally curable. I'm sorry, Hep C is totally curable if you, depending on the genotype. So that will reduce your risk of cancer of the liver. Next important point Dr. Chowdhury brought up is that lifestyle modification with reducing your stress, reduce and increasing your exercise, which will help you reduce stress.
Adequate hydration is something that gets ignored. Especially these days, we're all wearing masks. We really need to make sure that you have adequate hydration. That might, concentration, so the function of the kidney, unsupervised, we really need to, you're not sleeping well, then you go get a big cup of coffee because you need to stay awake. Coffee makes you go have more, urination, and next thing you know, your really inside is dehydrated. So your bile is more concentrated, your urine is more concentrated. You're forming stones there. You're forming stones in the bile ducts, and hydration of the liver is not there. And so hydration really needs to, and your colon doesn't want to function because you don't have as much water in your intestine, and then you get constipated, especially if you're also on a water pill. In the elderly population and after adulthood, I really don't want anybody to have packaged juices. If you're going to want to have an urge to have juices, eat the fruits. So you get the pulp, you get the flavor, and you get some of the juice, but none of the additives. So you're not putting yourself at risk for diabetes either, and hence fatty liver.
And the one other point we mentioned and we want to highlight again is less is good with medications. All those medications, supplements, over the counter, nothing is safe as far as your liver as it get older. And try to go once a year and talk to your primary care and get them reduced as few as you can. So be proactive about that.
You bring up a very good point. People say, well, I'm taking these 22 supplements, they're all natural. And I point out to them with respect that even cocaine is very natural. It came from so please do not get sucked into this thing about natural. Almost everything we have that's now synthetic started out as natural. So 20 or 2 or 3 more natural additives, and you could actually have substantial damage to the liver.
And not only that, the interactions, there's so much interaction between anything supplement, prescription medication versus supplement, prescription medication versus prescription medication. So less is critical in terms of reducing the drug to drug interaction. And poor liver, it has to deal with so much onslaught, and it does a beautiful job, but there is a limit it can handle. We come to the end of the show, and be nice to yourself, your fellow human beings. This is Dr. Mahajan signing off. We'll see you on the second Wednesday of next month with another exciting episode of From Mahajan Medical Center Studio here in Largo. Ciao. Namaste.